Good afternoon. Welcome, everyone. It's great to have you all here today for what will be a gripping webinar to launch our new research from vision to viability, funding requirements for effective early childhood hubs. My name is Emma Sydenham. I'm Director of Early Childhood here at Social Ventures Australia, and I'll be moderating the session today. I'm calling in from the lands of the Wadawurrung people, acknowledge their care for country over many thousands of years, their care for children, for families, for culture. Acknowledge the elders from the lands that you're calling in from today, and also the pain of colonisation and the extraordinary efforts across the country to rework for a new and reconciled Australia moving forward, which I think all of our dignity is dependent on. Acknowledge any Aboriginal and Torres Strait Islander peoples on the call today, and also the leadership of ACHs in this space who have really led the way. For those of you who don't know Social Ventures Australia, it is an innovative social impact organisation. We help solve challenging problems. We work on redesigning and nudging or influencing systems to alleviate disadvantage and supporting a country where all people and communities can thrive. This research is part of our Nurture Together program, which really has a vision around a joined up early childhood development system where all kids have the services and supports to flourish. We know too many kids across the country are really struggling. They're doing it really tough. They're struggling in development. They're living in significant hardship with families struggling to kind of provide and support the basics for them to thrive. This program really looks at what are the different models that we need to support different groups of children to make sure that everyone has the chance and the opportunity to really live their potential. It's got a particular focus on early childhood hubs, which we see as service and social hubs, really, where families can access service supports and connect. And really at the heart of it, it's around that place to build trust, to feel safe, to belong, and through that, to access the different supports that you need to be able to navigate your pathways through life. Early childhood hubs are one model of child and family hubs with some form of early learning as the front door. So over many years, SVA and lots of other partners have done extensive research around early childhood hubs, really looking at what's the landscape, what are core components, what's important for impact and for success, what's unmet need across the country, and how do we deliver, I guess, on that need. And what we've seen is that they can be absolutely life-changing for children and families, can change life trajectories and impact, can strengthen communities. What we've seen is the landscape is really increasing. We've got over 470 child and family hubs across the country, with at least 230 of those early childhood hubs. We've got many different types of models with really different characteristics, different sizes, different scopes, funded by governments, funded by philanthropy, supported and really driven by communities. And what we've got is growing momentum, I guess, around local integrated care for communities. So we believe that this is the moment to be really looking at how do we get hubs beyond special programs, special projects, to really embedding them in our early childhood infrastructure, in our early childhood systems across the country, so that they become the norm. Integrated place-based care becomes the norm, and we see hubs available across the country for all those kids who really need them. But to do this, we need a deep understanding of costing of components of hubs and the funding requirements for early childhood hubs. And that we have very little evidence, available data on. So that's why we did this research, really seeking to address that gap. So looking at the core cost components, looking at current funding approaches and what are the different implications of those, exploring whether there is optimal service delivery, models of delivery for service, and looking at what is a financial model and what are the requirements for an effective and sustainable funding model for hubs. Interestingly, we also tested the hypothesis of whether long daycare that's provided, when long daycare is provided within an early childhood hub, if it supports stronger viability, stronger financial sustainability through using the revenue sources of fees and subsidies to be able to cross-subsidise to integrated glue. So really unpacking like, what are the ways we bring hubs together to have impact, and how do we fund them in a sustainable way? Our ultimate hope is that it can contribute and we can collaboratively work together towards funding models that do enable scalable and responsive hubs. So what do you see today? Well, I would love to pass shortly to our Executive Director, who's a phenomenal woman who's led this research, to share some findings. We'll share some emerging policy recommendations out of those, and we'll have a panel discussion with some fabulous early childhood hub leaders who are deep in this every day and have a think about what's next. If you do have any questions, please pop them in the chat of any kind, and we'll try to get to them when we can over the course of the webinar. So to get us into the findings and what this report is all about, I would love to pass over to Biljana Nikolova, who's our Executive Director of Social Impact Initiatives. Tell us what we found, Biljana.
Emma, thank you so much, and good afternoon, everyone. And an absolute pleasure to be joining you today and to be sharing with you the key findings of this research that we've conducted together with Emma and her team. So today I'll share with you a little bit more about the methodologies that were used, and most importantly, we'll talk about some of the key findings and how we arrived at pretty much a view as to what or how much an ECH or fully functional ECH should cost, and what are some of the preferred models. So starting off with the methodology, we were very lucky and fortunate to be able to conduct a series of interviews and to meet and learn from a number of ECH providers around the country. We had interviews with 10 of those, and the 10 ECH providers were managing 13 ECH or hubs around the country, acknowledging that 2 of those were ACCOs, and also acknowledging that these organizations face many challenges that inhibit, obviously, their success. And this GOSINS project supports NAIC, National Voice of Our Children, in advocating for a unique funding model for ACCOs that supports Indigenous and Aboriginal and Torres Strait Island families and children. So in terms of the process of learning and obviously understanding the dynamics of hubs and the service provision, we had a series of well-structured interviews that provided great insights and qualitative information in terms of how these centres were run, or uniquely run by various providers. And to complement that, then we collected a significant amount of financial information to actually, get a better understanding of all the, I guess, income and costing kind of elements of hubs. And what we then did was we consolidated all that information into a financial model that also considered all the qualitative pieces that were very valuable in terms of or helping us to understand really the dynamics and really kind of put some color around the services that were provided, which services were core and which services were also, quite essential given some of the specific requirements of communities and children. So from there, then we moved on to thinking of, I guess, organizing our thinking, and we've developed, or we kind of decided to rely on this building block approach, which provides a nice framework or kind of breaks down the key elements of hubs, particularly those kind of costings elements. We looked at the income and how we fund all these costing elements, the key cost categories also were identified being glue staff, services staff, infrastructure, and other operating costs. And we identified the cost components within each of those cost categories. Obviously, the glue, that's pretty much the unique unit or the unique function that brings everything together. So we obviously looked at costing of the glue stuff. Then, in terms of the services that we were providing, the key categories that were coming across as core and essential: early learning and ECEC, maternal and child health, family support services, community designated activities, and allied health. Obviously, there were other services that were also provided depending on the specific needs of communities and children, so families and children. But, if they were quite unique for just a specific, I guess, hub, then they were pretty much bundled into those broader categories. Infrastructure was another important category that we looked at, and the key cost components of infrastructure were consult rooms, meeting and community rooms, informal spaces, play environment, and ECEC space. And also the last category, which is related to the overall operations of the ECH, not just those operating day-to-day expenses that we incur, such as, related to IT, electricity, cleaning, and so forth. So we have identified and categorized, obviously, the financials in these key areas to help us, obviously, inform the costings of hubs. So from there, then, once we have built the model, we started obviously zooming out and trying to understand all the moving parts and various correlations. So starting off with, and obviously we drew the key findings from that analysis. So the first key finding was around income. And this is probably not going to be a huge surprise to many of you joining us on the call today. ECHs have highly diverse funding models and income streams. And, income can come from, government sources, from philanthropy, fee-for-service. There was also some infrastructure provision and so forth. But I guess, mainly or predominantly, there was, the government funding was obviously present in each of those models that we looked at, or some form of government funding. Where funding was not available, services were often provided through partner delivery. And what we mean by partner delivery, that is usually reaching out to our network. So pretty much ECHs are so well, I guess we're a resilient crowd, and there is this significant process of establishing strong relationships with various service providers. And if the service could not be provided directly by the ECH and be obviously funded through this ECH, we had ways of reaching out to our networks and organizing, obviously, delivery of that service through the, existing service provider. So that's what we mean by partner delivery. And probably as an overarching finding and statement was that, this fragmented service funding created significant challenges for planning, integration, and sustainability for ECH. So not only that we found that not all the components of the ECH service provision were not funded quite often, but, we also found that there was this short-term, probably, and quite often uncertain funding, which made it very difficult to plan and to obviously, have access to longer-term resources. So that's on the income side of things. Then we started looking at the costs, or what was actually funded through these sources of income. And the most significant finding, starting with the glue, was that glue funding is absolutely fundamental, but interestingly enough, quite often it was overlooked. So we just assumed that the glue would somehow be provided for and be funded. And ECHs that were in a position to have access to specifically funded and dedicated and specifically funded and adequately funded glue, they were in a much better position, obviously being able to secure more services, to deliver more services. They established and operated strong governance structures and supported high level of integration. The difference between the level of service delivery of ECHs that had dedicated glue funding and the ones that they didn't have dedicated glue funding was significant as well. So we found that ECHs with funded glue provided on average 22 times more dollar value in part and delivery services than those without. So that is significant difference, right? And we also found that even where ECHs had no glue funding, they still worked hard to provide some glue functions, drawing on other revenue sources and staff time. So, for instance, if we were co-allocated with a school, quite often, if we had a very committed principal who really understood and valued, obviously, the importance of the glue, we would have, teachers or other staff dedicating part of their time or part of their obviously working hours in the delivery of glue services. So that's what we mean, finding ways to fund that or finding ways to kind of cross-subsidize that, which obviously we made it work, but far from optimal. Quite often that results to working very long hours, burnouts, and also I guess reliance on key staff or it kind of increases that key staff risk. So that was the second significant finding. The third one was around the ECC provision. And as Emma touched on previously, we started off this research work under the premise that we could actually, arrive at a scenario where ECCs could fund for the glue, or not the glue, but the ECH. And what we found that in areas where we have, complex dynamics and probably, in kind of lower socioeconomic demographics areas, it was the other way around. So we found that the inclusion of ECC generally increased the viability risk, and there was a need for higher cross-subsidization from other revenue sources and for ECH staffing. But what we also found that despite these challenges, and in most circumstances, the ECCs or the provision of childcare was financially challenged and quite often ran at a loss. But the provider still persisted with that, acknowledging obviously the importance and the benefits that we were providing to children and families, with the developmental, educational, and relational benefits. So moving on to the fourth finding, and this is around infrastructure. So in pretty much all of the circumstances, all of the cases that we considered, the funding models for the ECH required infrastructure provision at a minimal cost. And most of the ECH providers operated at a rent-free, often in government-owned buildings co-located with schools. We found that when the providers were bearing infrastructure maintenance and repair costs, the financial strain was quite significant to the point that, that was putting pressures to the viability of the ECH. So this is, I think, a very strong message for all of us, and particularly, I guess, significant, discussion that we need to have with governments and I guess other providers of capital in terms of being able to access this infrastructure at a minimal or no rental costs to be able to sustain and support the operations of ECHs. So from there, then, once we considered obviously the income sources and we looked at the glue, we looked at the services provision, infrastructure, then we started kind of thinking about the overarching funding models that were kind of either observed or we thought would be an interesting scenarios to consider in terms of how an ECH could operate. So the key finding here, based on all of that analysis, was that the secure, long-term, flexible funding model that was sufficient to meet the actual costs of the ECH delivery was, something that obviously was needed to support ECHs going forward. And when we talk about, flexible funding model, that is a pretty much referring to the fact that there is no standard. We kept talking about that, and the original idea was to identify an optimal ECH model. And the key finding also here was that, well, there's probably no such thing, right? So, because every community is different, the needs of children in various communities and families are quite different and unique. And to provide that best support, we need to be able to adjust. And whilst we're talking about, non-existence of optimal ECH model, there is definitely a preferred ECH model. And in scenarios or in communities where we had uninterrupted access to services and adequate services that we could tap into, we found that the partner delivery model was quite functional, and that's something that obviously funds the glue and funds the operating expenses of the ECH. But I guess it didn't require significant investment in infrastructure, which is usually quite onerous and quite expensive. So what we did was to help us obviously identify, kind of observe various scenarios and how much would it cost to actually run an ECH under various scenarios. We came up with these 3 specific service models. One is the partner delivery, the other one is hybrid, and the third one is in-house. And then we needed to kind of look at what was an average community size that we pretty much could service or should service to give us an indication of what that cost kind of should be, or where the cost should be for the ECH. So we looked at a community of 100 families, and we assumed that there was an ECEC that provided about 60 spaces. So the community would probably have about, between 100 and 200 kids also that would be serviced. And we also considered a Metro New South Wales kind of area. So from a geographical perspective, we decided to kind of anchor on Metro New South Wales. So also considering that different geographies will have different, obviously, characteristics and pricing points. So based on those parameters, so average community of 100 families, up to 200 kids, 60 spaces, ECEC spaces, we found that the cost to stand up the glue, and that's the busy table on the right-hand side. So the total ECH operating cost with dedicated glue is $800,000 per annum. That doesn't include infrastructure costs. So the purple box down the bottom of 1.39 million is how much we will need to set up an infrastructure cost for that partner delivery. What we mean by partner delivery? So we have a dedicated glue that is costing us $560,000. We obviously provide for rent, maintenance, and other operating costs, but we're assuming that we're co-located, right? We're co-located, let's say, with a local school, and we have access to various services that are functioning well, and communities can be, or children and families can be referred to various services, be it allied help, be that other kind of professionals that provide the right support. So a total cost including infrastructure of 2.91 million, but if we refer to the models that we have observed, where in most circumstances the infrastructure was provided through a co-location, we are looking at total cost of $800,000 per annum to run a ECH operation. And then we looked at the hybrid model and the in-house model. So the hybrid model is again an operation where, for instance, we pretty much said, well, let's assume that we can't get access to appropriate family support services, and we can't get access to adequate health and medicine, allied health and medicine services. We need to bring that in-house. So we need to find professionals that will be paid through the ECH to deliver that in-house. So on that basis, our cost goes up. So the total ECH operating cost is 1.49 million, and then we consider that additional infrastructure cost that's required. And then the last scenario, which is that in-house, and that's pretty much just a hypothetical scenario where, in finance terms, we usually call it like a worst case scenario where we're in an environment where we don't have access to any services, and it's extreme. We just have to provide everything in-house, and it gets quite expensive, right? So we're looking at this ECH operating cost of 3.9, and then the infrastructure cost goes through the roof at 9.33 million. That assumes that we're building our childcare center as well. So in terms of once we've kind of observed all of this and based on the qualitative and quantitative data, so the deduction was that the preferred model would be that partner delivery model. And again, going back to we have a dedicated glue funding. So each of our models recognize the absolute or the significant and important role that the glue function is performing. So all of our models are pretty much including dedicated funding for the glue. So we have a dedicated funding, and then we are developing great networks and relationships with service providers in our community, and we're referring our children and families to the appropriate, obviously, services. Quite often, those services could also be provided on premises if we have the right infrastructure. They're still paid through, obviously, existing sources of funding, which were in place already. But quite often we can also have those professionals come on ground and provide those services within the ECH, because we've seen the benefits of services being provided in the trusted environment, and all of a sudden families turn up for appointments and they feel much more comfortable accessing those services. So overall, we're getting much better outcomes for children and families. So that's pretty much the key findings from our study. And again, just summarizing all of that, one of those things when they say what I would like you to walk away with today. Well, number one, we need sustainable and adequate funding for ECH operations. Number two, partnerships with government are essential. Number three, ECHs build trust with communities, leading to more efficient investment and better outcomes for children and families. And number four, partner delivery of services is the preferred model. Thank you all for listening, and Emma, back to you.
Fantastic. Thanks, Biljana. That's a wonderful summary. So I guess then thinking about from those takeaways, where do we see the opportunity to act on them? And first and foremost, I think we are saying centre integration as a priority in all current government reform opportunities, whether that's the thriving kids. Hubs can be a really powerful implementation pathway to support the Building Early Education Fund. If we include 1.3 million only to set up the infrastructure of the hubs around the long daycare, we can really far better meet children's needs and ensure that long daycare is actually used and that we get benefits from it. Look at the service delivery price project, build in research at a larger scale around costing of hubs. So we can work on at a much larger scale those funding requirements in a collaboratively way with government. And through these mechanisms, we think we can really start to stitch up our system or build a much more cohesive child and family system. So I guess that's our first takeaway or opportunity, really embedding integration across the spectrum. Short term, let's fund existing hubs with no glue now and those facing sustainability risks. We see so much potential just to unlock impact really quickly there. We've got existing mechanisms like the Community Childcare Fund, which could be used to expand and update to be able to do that quickly while we're investing in the long term opportunities, which is really how do we collaborate as a sector, state governments, Commonwealth governments, on really developing up an adequate funding model that builds from existing streams, that redresses gaps in those funding streams, that ensures glue is core and non-negotiable. SNAIC's been advocating for a very long time for an ACO funding model. They've got a great report out. It's very centred in the Closing the Gap policy partnership group. Now is the time to act to really embed a specific funding model for ACOs and to build in the necessary supports to support a really strong and thriving sector. SNAIC's Early Years Support Division is a great example of what that looks like. We heard the issues that the early childhood education and care funding system is just not fit for purpose. Reform for that feels so urgent. So many children are missing out at the moment on critical early learning opportunities there, really highlighted here around that cross-subsidisation from other parts of a hub to make that viable. That needs to change. We're not going to share all the recommendations. This is a few of some of the key ones. We'd love you to check out the report, look at those in full detail. We'd love to chat to you about those. We see this as a joint, journey, I guess, how we can help move them forward together. But let's see what the panel has to say. I'd love to introduce to you a wonderful panel here. We have Frances Martin, who's the Director of Strategy for the Colman Education Foundation. She heads up their work on systems change and government relations, as well as place-based teams in many of the Victorian communities where the Our Place model is located. We've got Jo Ineson, who's the Early Years Director at Salvation Army. She does an amazing job working with Balga's diverse and vibrant community around Perth, really supporting safe, welcoming environments for kids and families to thrive there. We have Olivia Wright joining us from the New South Wales Council of Social Services. She's done some amazing work as director of the NCOS School Gateway Project, which is set up and is operating Marang Hub in southwest Sydney. And I would like to really note the importance again of Aboriginal and Torres Strait Islander early childhood hubs in this discussion. We would love to have had one of those leaders or SNAIC here today. They are super stretched. They reflect all of the challenges in a really big mission and a really big commitment to meet that mission, and we're not able to be here. Again, just want to re-emphasise that they have led the way in this space with their work over many decades, and that SNAIC's work is really taking huge strides forward in what solutions could look like, and we really support that work. So, Frances, if we can kick off with you with a little context, can you talk us through a little bit Our Place, some of the characteristics of your funding model?
Thanks, Emma. It's lovely to be here today, and I'm joining you all from Bunurong land, and I'll pay my respect to the elders of these lands, as well as to the various lands and communities that Our Place is privileged enough to walk alongside. And can I just say that I'm feeling particularly excited to be a resident of Victoria at the moment as we progress on our path to treaty. And so I'd like to acknowledge the hard work and leadership that's been shown in that process. So about Our Place. Our Place is a model of integration, which is a fully integrated school and early childhood hub model that we have built off the evidence base from the early work at Doveton College, as well as the international evidence at Harland Children's Zones and Sure Start in the UK. We're currently testing that model in 11 sites across 9 communities in Victoria for a 10-year period in each community. And we're about just past the halfway mark of that 10-year period. In terms of the funding model that we operate, I'll get to that specific part for this webinar. We have a fairly unique partnership arrangement between philanthropy and government, which enables our work. The Colman Education Foundation and 9 other philanthropic partners fund the what's known more commonly now as glue rolls at each of our sites, as well as the backbone organisation which supports the work. The Victorian government and local government have funded the infrastructure, the fit for purpose infrastructure, which enables our hubs to operate, as well as provide critical in-kind support for the governance and partnership work that this integration takes. And particularly our partnership with the Victorian Department of Education, who are huge enablers of our work. That partnership ensures that the overarching approach is governed by a set of pretty high-level decision makers from across the Victorian government. So we're exceptionally fortunate to have that arrangement. But by working in partnership and being based in schools in particular, it means our funding model has we see a very kind of cost-effective comparative to operating costs ratio. And I really think this research is very exciting because it speaks to obviously the costs of the more visible elements of hubs, such as infrastructure and those glue roles, but it also speaks to the importance of funding and resourcing for those back-end partnerships and governance that actually make this work possible on the ground.
Amazing. Thanks, Frances. Jo, can we head to you? You're working in a really localised model there in Balga. Can you talk us through your work there?
Sure. Well, thank you for having me today. I come from Balga, WA, which is the land of the Whadjuk people and the Noongar people. We are a very boutique, unique service. We've been operated and owned by the Salvation Army for 45 years. And the whole early years hub here was started by the church people back at that time when they realised that this community was back in the day, without the words being there, was a low socio community, and there was many different social issues. And obviously in this day and age, we call those complexities and vulnerabilities. And the service here started from a play group, which happened a couple of times a week. And over the years, it has become an early learning centre, which is for 83 children during school terms. We have 50 children a day. Sorry, that's the wrong way around. We have 50 children a day during the school terms and 83 children a day during the school holidays. We're a preferred service provider with the WA Department for Health to provide full-time child health nursing for a decade into this community, so that we could support families to make sure that those very, very early days of parenting were being supported, and parents could receive weight checks, at-home checks, and all the things that are super critical in those very early days. We have a play group. We have retained a child health nurse. We now offer free lactation consultant sessions. We offer parenting groups. We have play groups, we have music sessions, we have a partnership with local primary schools, and we try to keep our children and our families here from before they're born right up until we have, well, I now employ children that I used to look after when I first moved here. And we are located in the Salvation Army's buildings, and we have co-located community services here that support families with emergency relief, with financial counselling, with domestic violence. We have specialised youth groups, we have specialised DV services, specialised alcohol and addiction services. We have a coffee shop that runs from here, and we have so many different community hubs from here. And I think it's probably a very true statement to say that there would not be one family in Balga that does not have some kind of connection with the Salvation Army services here. And the joy there is that it all starts through the early years services. We have third and fourth generations of families coming through here. And the funding model, we can talk about that later, but I just want to stress that working here is a privilege, and actually being at the forefront of community support and early years things and being the glue in these services, it's just an immense privilege.
That's extraordinary. Thanks, Jo. That really brought to life exactly like, the spectrum and expanse of being a place for community, right? Whatever those needs or complexities or desires or wants are, that's very special. Olivia, so Marang built from the Our Place model originally. Can you tell us a little bit about that and your context there and the funding characteristics?
Sure, thank you, Emma. I want to acknowledge that I'm coming from Gadigal lands in Sydney, and I think firstly I want to applaud SVA for this research. The two questions I get asked most frequently with regards to the NCOS School Gateway project are, how do we scale this work and what does it cost? So this cost analysis is critical foundational work in understanding the requirements of funding for this important hub work. In 2021, NCOS received a grant from the Alan and Jill Gray Philanthropic Foundation to seed a school-based community hub. And yes, we took the Our Place approach as a starting point, but we wanted to understand that work and the opportunity in a New South Wales policy and practice setting. 5 years on, and we have a thriving school-based hub at the Ashcroft Public School in southwest Sydney in the Liverpool LGA. It's called Murrung, which is the Darug word for belonging. And although it's really only 3 years young, we've seen some really significant results in all of the education indicators that we're measuring, like attendance, student, child and family wellbeing, teacher wellbeing, and also academic growth. I think this year we're about to release an impact report, and for the first time in memory, but certainly since I've been working at the school, we are now above state average in attendance. We've seen really remarkable, like 300% in growth around year one phonics, which is related to the work that we've been doing in developmental vulnerability in the early years in the preschool. I guess we premised, but focusing on the funding model, we premised the setup of the hub on the principle of improving accessibility to the services that were the services across the three siloed systems, the health, education and community service systems. And our key aim was really to unlock existing funding in the system, to work within the funded envelope of services in the community and health systems within the 2168 postcode. So the philanthropic funding that we received has resourced the NCOS role, that key glue function that you've talked about already, but also annual research and evaluation of the work that we do. And because of the context of our school community, in which 75% of students and their families come from non-English speaking background, we also fund 2 part-time roles within the hub that are aimed to build community cultural safety. We have a Swahili speaker and a Samoan speaker, and we also actually partly fund the Aboriginal Education Officer. But I guess the key point to make at this stage is that because of our context in a school setting, the hub, the infrastructure, the resourcing, and even to some extent, some of the service delivery is funded within the budget of the school's operation. So through entitlements and also a discretionary budget that's tied to equity loading. And so outside of what is funded within the system, it's really the glue role and the crucial work of reorienting those health and social services to be delivered in the school setting.
Fantastic. And I just want to say, so good to be doing the impact reports. We really need to keep building the evidence base on that impact. I can't wait for this next one to come out. So you talked a bit about the glue there, and particularly in your context, the glue is the additional bit that's actually you require funding for. The rest is kind of within the existing service system. Can you unpack for us a little bit more like what that looks like? What does it take to deliver the glue? What do you see as the optimal funding parameters to enable you to be effective?
Yeah, sure. Look, there's lots of research. Lots of it has been done by SVA and published by SVA and Our Place and the other key organisations in this space that highlights the diverse and really varied role of glues in hub settings. For me, the key functions, I guess, have been relationship building, navigating, negotiating, encouraging, cajoling services to integrate for the benefit of the community, of children and their families. In the school context, obviously, I think there's been a really significant culture change in this way of working. It is a very different way of working. And so there's been a considerable piece of work involved in realigning school thinking, in building professional knowledge or understanding of the impacts of living in disadvantage across the entire staff so that the hub work is fully integrated into the school, and we can operate on the principle of no wrong door. All of the school staff have been, we've had a program of professional learning to talk about poverty and what does it look like and what is it like for a family to live in disadvantage. And that's been a really critical part of integrating the hub in, so that it is now part of the DNA of the school. It's an approach as opposed to a hub, and I'm sure I took that language from our place as well, as we do so much of the work we do. So that's been really critical, that cultural shift internally, but equally in a community like Ashcroft, which experiences really significant socioeconomic disadvantage, the service delivery is fragmented, uncoordinated. Community talk about services being hard to access. They don't know about services that are available. And often when they do know these services are delivered with conditions, they all require slightly different referral paperwork. And so another key function of the glue has been linking services, navigating barriers, fostering trust between families and service providers, pushing back on some of the restrictions, supporting families so they only tell their story once to the various providers that are supporting a family when they're living in those complex circumstances. So it is a bit of a straddle. It's negotiating across agencies, from government-funded services into community and back, from service delivery workforce vertically up into the management and key stakeholders. And so I think one of the key points I would make is that independence of that glue role has been a really critical thing for us in the context of the hub we have in the education system. I guess in practice, it's a constantly changing function, and that will be absolutely no surprise to anyone who works in hubs. It is constantly, the work is constantly changing because it's responsive to community and to evolving what's going on in the environment. It has to be responsive. It's hard to articulate, therefore it's quite hard to measure. But I would say that having had unrestricted philanthropic funding for 5 years has been a critical part of the success of the hub in the initial development phase, and also in this early delivery phase of the work.
Imagine that consistency of personnel there to really build those relationships and carry that forward is so critical, particularly that first part, but all the way through. Frances, talking there a lot about this kind of partner delivery model where you're using the existing service system. Can you talk us through your thoughts on that and what you think that requires for effective operation?
Yes, absolutely. Although I will start by saying, I fully agree with Olivia's done an excellent job there about describing a lot of the what it takes on the ground to make that happen. And I just reiterate it. We don't think that the hub discussion can be about more funding for services. Times are tight in many environments, and a lot of these communities have a large, should we say, service opportunities, but also service burden to an extent. And a lot of the challenges lie in how those services are able to be delivered, how accessible they are, and the inefficiencies that come from having multiple providers, multiple departments, multiple jurisdictions. So yes, our place is a fully partner delivery model as well. All the direct service delivery at our sites is done by discrete service organisations. So an average for an Our Place site is approximately 26 services and activities operating. And that means for us across the state, we have more than 110 partnerships on the go at any one point. And so that investment in the infrastructure, those glue roles, is really about unlocking that value. And I mean, Biljana and Olivia have spoken to this, but I mean, a small example, if people are looking for outcomes, is one of our communities, the local allied health service, relocated from providing in-town provision to at the school site, and saw a 50% decrease in failure to attend rates over that period. And so I think it's one of many examples of what value this way of working unlocks. So we do think in many circumstances it is the most efficient and sustainable way of building a service system. but it absolutely adds complexity. And more we're seeing that people understand the need for governance, for, as Olivia's pointed out, for some form of independent arbitrator to navigate those relationships, and the corporate support that is required to make those on ground. If we're expecting these relationships to be only dependent on the individuals that happen to be working at the hubs at that point in time, then they will inherently be unstable and are prone to falling over when there's a challenge or a change in personnel, which is, inevitable in all our communities if we're thinking about being there for the long term. And so having a partner delivery model absolutely requires governance. It requires agreements at times. It requires the ability to escalate. And so it's really important that there's a real kind of pay what it takes mentality. If we're going to set this methodology up as a really core part of the service system for the long term, if we continue to see it as really just the frontline hub staff's role to, on their own, shift the whole service system, then I think we can guarantee ourselves disappointment if we're not willing to invest in the back end. And so I'll just say one of the other key lessons for us is you can invest in the glue and the infrastructure, but it's also about the expectations and authorization given to the services from their funders and from their leaders to ensure that they are empowered and expected to deliver their services differently. As Olivia mentioned, there's plenty of influencing and cajoling required, even with the most on board of partners. And I think it's a lot depends on that authorizing environment that we set up as a sector.
Super powerful insight. Thank you. Jo, I'd love to come to you. One of the fascinating parts of this research is around sort of the long daycare component. And, we're looking for how do we, where are the existing funding sources to help hubs be viable? And, is long daycare one of them? And we found actually the opposite was true. Can you tell us, you have sort of long daycare within your service. Can you, talk us through that? Is that the case for you? Like, what are the drivers for that you see?
Sure. So I think from my point of view and my very local context here, it's very interesting because funding is non-existent, but yet we do have the parent organisation of the Salvation Army. So we have a lot of background systems and infrastructure that we can use. The suburbs that we're in, Balga, Kandula, Girraween, Nullamara, Westminster, they are all low socio suburbs, and on the CEFA index, they are at the upper end of need. And it also then translates, unfortunately, that the children in these suburbs are vulnerable on at least two developmental domains by considerably higher than across other areas. So our long daycare centre cannot charge market rates. So our full fee at the moment is actually $115, and that went up $10 in July. And we probably only receive that from about 80% of our parents. And we only receive the gap fee from 80% of our parents. We rely heavily on brokerage, which we have to secure through philanthropic organisations, through some grants and some local funding. So the reality of the long daycare being able to fund a hub is non-existent. And certainly in our setting, the glue that is provided, that comes from my wage, which is fully funded through the ELC, which will often mean that we have to share our resources or our staffing, or it just means that the functions of my particular role of the early years here have to get stretched out. We are very fortunate because we are the Salvation Army. So I think we are a very trusted and familiar brand. So we are able to apply for funding and brokerage, and certainly within WA, there is money to be found. But the reality is philanthropic agencies can only go so far, and it's very difficult to secure funding for what are essentially government provided services. So when we're talking about child health and we're talking about early learning and long daycare, there are other funding systems out there. So for a community-based not-for-profit, it can be very difficult. And then when you take us into a shire context, and people will often look at the shire that you are in for funding and at your rating in your shire, it doesn't always go down to the suburb. So there's been many times over the years when we've applied for funding, but because we are in the shire of Stirling, which is a very rich shire, we're not actually applicable for funding. So we rely very heavily on community donations, on philanthropic things, and the relationships. And what was the phrase? The cajoling and massaging of relationships and partnerships. that's definitely how we do it here. But I think, and in our context here, the long daycare centre, it really is the foundation stone of everything else that happens here. That is the trusted area. Parents need long daycare. They are working 2 or 3 jobs. They are living in people's garages. They are living in their cars. They're living at the local park. And they will drop their child into the service in the morning, knowing that care and nurturing and education will happen. And often it's not really from a choice of, this is best for my child. It's like, this is actually a crisis point in my life. This is what I need. And then we can just do a lot of relationship support around them. So it's like, you are safe, your child is safe, you are welcome here. We can pay your fees for a little while, but let's hook you into the child health nurse to make sure that your 2-year-old has actually met their ages and stages. Let's walk you across to the financial counsellor to see if they can advocate for you with all the various debtors and creditors and people that are out there. Let's see if we can offer you some playgroup support so that you can get to your various groups that are needed for whatever internal things that you're trying to work on. And it just creates that hub very naturally. But trying to pull together all the different funding, that is very difficult. It's like a sword that's always over my head. It's what keeps me awake at night.
That certainly came through so powerfully in this research. I think how much time, energy, mental load goes in just to keeping the hub open. Yeah. And also, yeah, interesting, as you say, like early learning feels like such a core pillar, and regardless of how difficult it is to keep scrambling to sort of fund it, that all the hubs still did that. Who had it, which was really interesting. So Jo, I might stay with you. So if you've got one message then to give to decision makers as we're sort of working in this reform environment, trying to really build and nudge the system to becoming more centred around children, what's your message around to decision makers today you'd like to share?
I think we really need to change the data that they look at. We cannot provide data that shows how this 2-year-old has met all their developmental domains. Why that parent, when she's turned up wearing her lipstick today, why she's doing so much better. They don't understand that data. They may not have been in that position. And if we could just find a measure and a way that they really can get hold of that and see how this transforms lives and creates that positive impact time after time, and it stops the cycles of destruction, it stops, all the preventative things that are needed in life, that's where we need to push them, go, look at it differently, look at community, look at it from a parent and a family-centred place, and actually bring the funding back into communities and help us record this in a way that actually tracks progress, not just transactional infrastructure, how many people we've seen. Look at how we've done it.
Yeah. Measure what matters. I love that. Yeah. Bring it back to that. Thank you. Olivia, what would you say to decision makers?
It has to be that we need to find a way to deliver long-term dedicated funding to the glue role in hubs. This is relational work. It's building trust in different contexts and settings. It requires patience, time, flexibility. It's not programmatic, so it can't be delivered in countable chunks of service. And so we need to find a way, I think ultimately, for government to fund beyond the work of great individual philanthropists to deliberately fund the critical work of the linker. And I mean, our philanthropic funding is up at the end of the year, and it was never our intention that the work would be funded by philanthropy forever. So I guess it's crucial that we find a sustainable way to fund across agencies deliberately this role of the glue.
Fantastic. Thanks, Olivia. And last but not least, Frances.
Well, with data, the call for data and better funding taken, which I heartily concur with, I'll just reiterate that integration is not just glue funding. Integration is also about how the services and sectors are set up to integrate. And so as funders, even if you are in a tight fiscal environment, which is how we describe it in Victoria, I think, as having no money, it's about how you commission services and the expectations you have. And the final thing I'd say, it's probably in the easy to do bucket, is go visit a hub or go visit a community. I think Olivia and Jo have done a great job of bringing that to life. Hear from the families who experience it, hear from the staff, and invite your boss along if you're having trouble convincing them. We're certainly always happy to host visitors, and I'm sure Olivia and Joe won't mind giving you a cuppa either at your sites.
Totally back that up. There's
Absolutely.
nothing more powerful than seeing these hubs in motion. And on that note, I would love to thank you all. You're all such extraordinary leaders, doing so much work in your communities and so dedicated. Thank you for your time today and the work you do. I want to really acknowledge all sort of hub leaders, practitioners who are working really hard, very committed to change the way our systems work at a local level and to support families and support families with agency and partnership and children. It's so powerful. Also want to acknowledge the amazing work that a lot of bureaucrats within government departments are doing to help nudge the system to work better for children and families. This really is a collective journey. We'd love to build from this, working with collectively with sector leaders, with hubs, with government around what does a responsive, long-term, adequate funding model look like? How can we build on what we've got? How do we chart a pathway from here to really do that, really seizing the opportunities that we have at the moment? Please download the report. The QR code is there. We'll circulate it afterwards. We have a couple of other pieces coming up. One extraordinary piece working with 17 families and 5 hubs with taxi. That's coming out next month. We'd love to share that with you. Please join the National Child and Family Hubs Network if you haven't. We are all part of that, really trying to galvanise, come together as a collective voice, learn together, grow together, advocate, so that we can embed early childhood hubs within systems across the country and see more children thriving. I would love to acknowledge our funders, finally. Huge thanks to Minderoo Foundation and the Berg Family Foundation, without which this work would absolutely not happen. 2 funders who are deeply dedicated to this mission and to really seeing our systems with children and families at the centre. Thank you so much. Thanks everyone else for joining today. Please have a look at the report. We'd love to hear any thoughts and feedback as always, and look forward to really working with you on this next part of the journey. Thank you and have a wonderful afternoon.